I've got good news for once. Someone in America has had an incredible year, a record year, actually a historic year. And it's actually 7 somebodies. And those 7 somebodies are the largest for-profit health insurance companies out there. And they pulled in $1.7 trillion in revenue last year. And at least $54 billion of that was pure profit. And I say at least because these companies hide money the way my dog hides my shoes. Constantly, badly, and with zero shame. And my dog, she doesn't chew them, she just hides them when she's mad that I left. And she only does it when it's raining, oddly. Anyway, meanwhile, you are left on hold. You've been on hold since March. You're listening to a smooth jazz cover of somebody that I used to know, waiting to find out whether the MRI that your doctor ordered is actually medically necessary. And the guy making that decision is a guy named Chad with a computer script and a flowchart of rejection. Look, the health insurance racket has gotten so big, so greedy, and so shameless that even Republicans are starting to say we need to break them up. Congressman Greg Murphy, a surgeon, a Republican from North Carolina, co-chair of the GOP Doctors Caucus, just wrote that these 7 companies are taking almost $2 trillion a year from the American people while increasingly denying care to the people who need it most. When the co-chair of the Republican Doctors Caucus starts sounding more like Bernie Sanders, the wheels of our healthcare in America have officially come off the wagon. And for you right-wingers out there that don't want my tax dollars going to someone else's healthcare, chew on these numbers with me. UnitedHealthcare, the biggest of these companies, now gets more than 77% of its revenue from government programs. Your tax dollars. UnitedHealthcare's profits are privatized, sure. But the way they earn that money? Public money. Your money. And since 2015, the top 7 companies have spent more than $137 billion, not on lowering your premiums, not on approving your claims, but on buying back their own stock, and I've covered this before. That pumps up their share price, which pumps up the executive bonuses, which hides how shaky their business actually is. And by the way, for most of the 20th century, stock buybacks like that were basically illegal. Regulators classified them as market manipulation. And to go back to a theme that has been constant on this channel, Ring of Fire, for a couple of decades, if you or I snagged a $10 bill that didn't belong to us, we'd be in cuffs. But if you're wearing an expensive suit and you sit in boardrooms all day, you can take billions from taxpayers and you get invited to fancy parties. When we really need to see these assholes perp walked. Instead, they're going to be at the next fundraising dinner wearing a tux. And here's what I want to hear from in the comments. Tell me about the claim they denied that you know needed to be covered, the surgery, the medication, the ambulance ride that they decided was luxury. Don't get too personal, but I want this comment section to read like a Yelp page for that one restaurant in town. You know the one. And now, despite being the guy claiming to bring down the healthcare prices, you know who agrees about the insurance companies? The healthiest man in the world himself, Donald J. Trump. And he has posted, in all caps, about the big, fat, rich insurance companies ripping off America. And you know what? He's diagnosed them correctly. The problem is the prescription, the cure. Because Donald Trump's big plan is to yank the subsidies and hand you a health savings account instead. A coupon. Here's a couple of grand, kid. Now go negotiate with an industry that just cleared $1.7 trillion. Good luck out there. I mean, it sounds a lot like your grandma's got a real painful burr on her heel. If you rub it for me, I'll give you a whole quarter, Rusty. And look, we've been down this road. High deductible plans plus these savings accounts. And the ending is always millions of people in medical debt. And the part that makes me want to put my head through drywall, these people take your premium every single month like clockwork. Miss a payment, canceled. But when it's their turn to pay, suddenly everything needs review, prior authorizations, peer-to-peer consultations, titration. You have to fax things. A fax machine in 2026. I worked briefly in medical sales, and yeah, fax machines are a thing. These people will resurrect dead technology from the grave before they'll approve your kid's medication. And members of both parties on the House floor are saying we need to break these up. And an industry this size will spend whatever it takes to make sure that that never, ever happens. These companies run the most powerful lobby in Washington, and they have got 137 billion reasons to protect their game. So we've got to keep the pressure on. And that's why I want you to hit that notification bell, because you are not going to see a segment about insurance company stock buybacks wedged between all of the pharmaceutical ads that happen to be on cable news. Funny how that works.